why they have to drop their dogs and cats off so early in the morning for a surgical procedure. So today what we're going to do is walk you through what happens once you leave your pet at the clinic for their surgical procedure. So the first thing they do, once you sign your paperwork and we take your baby from you, we walk back here to our treatment area and we set them up in one of these really nice kennels with a pillow and a blanket, and one of our technicians will help them kind of just de-stress and relax once we take them and get them all set up prior to doing any kind of procedures. After that, what we do is our technician, this is Alicia, she is going to get a temperature, pulse, and respiration on your baby. We'll help her. All right, starting with the temperature. All right, and then we're going to get a heart rate and a respiration rate. With our checkoff list, which I will show you briefly. The checkoff list is everything that we're going to do for your dog while they're here in the hospital, including setting up our OR, which is right behind you guys. So in here we have set up for our surgery. We have all of our equipment, our monitoring equipment as well, ready to go. So that gets set up. And then we'll let your baby hang out. Dr. Lockwood. All right, so now Dr. Lockwood is going to perform her exam on our patient. So she's going to listen to her heart and lungs. She'll also just kind of do a brief exam, just make sure she's healthy enough before we take her into surgery. Next, one of our technicians is going to pull up drugs specifically calculated for your dog. So right behind me is Alicia. She is a surgery tech today, and she is calculating drug doses for our patient, and then she will pull them up into the syringes to be given later. These drugs are going to include anything that we're going to use to sedate, pain medications, and also the drugs that we use to induce anesthesia. So we just pre-medded our surgery patient, which means we gave her an injection of a couple medications. Something to preemptively control pain, and also something to help reduce anxiety and help keep her calm. So we give that in the muscle, so it doesn't work instantly. It does take some time for it to start taking effect. And you can see Alicia here recording on this patient's medical record, the drugs we gave, how much we gave, the time we gave it, and the location. While we're waiting for that medication to start taking effect, we're going to start prepping to place an IV catheter in our patient. So you can see over here, we have an IV catheter and all the supplies needed. So what this does is it gives us quick access to a vein. In case of emergency, we can deliver drugs very quickly. It also allows us to give IV fluids while she's under anesthesia. IV fluids are going to help maintain blood pressure and also help keep her organs nice and healthy. The drugs that the organs that metabolize these drugs, her liver and kidney, it will just help flush everything. All right, so Alicia has just placed the IV catheter in our patient. We did so aseptically, and now she is going to flush to make sure that we are still placed well. Beautiful. All right, so now our patient is ready for surgery. So the next step would be to move her into the operating room. Well, we will induce anesthesia and get her prepped and hooked up to all the monitoring equipment, and then we will proceed with the procedure. So now we are in our procedure. So our dog is being spayed today. So behind me in just a minute, I will step aside, but Dr. Lockwood has prepared aseptically. She has a mask and cap and gown and surgical gloves, and she will be doing the procedure on our patient. We also have 2 technicians in the OR at all times, where they'll be monitoring vitals and also reflexes. We monitor the same vitals that they do in human hospitals, including heart rate, respiration rate, temperature, blood oxygen levels, and carbon dioxide levels. So I'm about to step back where you'll see our patient under anesthesia. You will not see any blood, I promise. So now our patient is in recovery. So she had her procedure done and she recovered a little bit in the OR on oxygen. Then we bring her back out to the kennel in the treatment area where she can recover quietly. Notice she does have an e-collar on, which will prevent her from getting to that incision or licking it or causing any irritations. And again, our surgery tech, Alicia, was checking on her, making sure she's doing okay. The reason we like to keep them in the treatment room is just to be sure we can keep an eye on them the whole time they're in recovery. So if there are any issues, we can catch it very quickly. But she hangs out with us for a little while until she's ready to go home with mom and dad. And then you guys, of course, pick your babies up and take care of them and make sure they stay nice and healthy. And that concludes our video on what happens to your pet after you drop them off for surgery. Thanks for tuning in. If you have any questions about this video or anything at all pertaining to your pet, you can always give our office a phone call at 904-671-0310. We'll be happy to talk to you and answer any questions you have. Thanks from Floof and the whole staff here at Crosswinds Veterinary Hospital.